Okay, white fillings. Well, in the past, when I trained and qualified in 1985, all those years ago, the only thing that we had to fill teeth which had cavities was a material called silver amalgam. And I think you might be familiar with that. It's a grey coloured metallic filling material, and it's rather unattractive, and also unfortunately it releases a very small quantity of mercury. Now, we don't think that that mercury is harmful, but it certainly isn't good for you. So in modern dentistry, we have eliminated the need for using silver grey mercury containing fillings. Nobody liked the look of them, and the fact of the mercury really has rung the death knell for that as a treatment. So we now use white coloured filling materials in back teeth, in front teeth, wherever that's necessary. And the material basically is packed into the hole that's formed as a result of some decay or maybe a fracture of the tooth, and then we set it with a special blue light and then polish and contour it, and it looks almost as good as new. And sometimes I can show a patient a piece of dentistry we've done of this nature, and they're not quite sure which of the teeth are that we've filled. It's that convincing. And they're a good, long-lasting, durable solution. They don't work for everything. If the cavity is about 2/3 of the width of the tooth or more, then a white filling wouldn't really work. It wouldn't be quite sort of suitable for the job. And then you might need to have a crown or a porcelain inlay or another piece of dentistry that would be strong enough for that. But when you're considering having fillings, I think nowadays most dentists would agree that we need to do white fillings, and that's certainly what we do here. We don't even have the machine that makes the silver fillings, we only do white fillings. So if you're interested in that, come along for a consultation, we'll talk you through the process, and we'd be very happy to help. Thank you.